Hi, I'm Marie Szymanski, a pediatric rheumatologist and a community engagement coordinator for the Arthritis Foundation in the North and Central Florida regions. I'm here today to talk a little bit about COVID-19 and arthritis. We're trying to reach out through video in this time of social distancing to let you know that the Arthritis Foundation is here for you. I will say anything in this video is very general, and in your particular situation, if you have questions about your own care or the care of a loved one, please do reach out to your doctor or team of doctors and always follow their plan of care. So I want to review some of the questions that we tend to get most frequently from our families and patients that have been reaching out to us. One of the questions that we've received often is, what are the symptoms of COVID-19? And right now, there are a whole range of symptoms that have been reported in COVID-19. Some people are completely asymptomatic. However, these people can still be carriers and can still make others sick, which is why it is so important for people to try to remain home as much as possible at this time. In addition, many will suffer from a flu-like illness with fevers, muscle aches, and cough. Other patients, though, too, will become critically ill and develop pneumonia and difficulty breathing. And so we're asking, please, everyone, if possible, to stay home so that we can help prevent further transmission of this virus. An additional question that we get, and I'm going to refer to my list of questions here frequently, is what can I do to prevent infection with COVID-19? So many of these things I'm sure you've heard already, but one of the things that you can do yourself to try and prevent infection is to wash your hands with soap and water for at least 20 seconds each time you go to wash them or each time you believe that they are soiled. They do not need to be visibly soiled for you to wash your hands. If soap and water is not readily available, we recommend that you use an alcohol-based hand sanitizer with at least 60% alcohol as a component of the gel. In addition, it's important to sanitize surfaces and other items such as keys and phones that you may be using frequently throughout the day. And now also in this day and age, we have some new terms in our vocabulary such as social distancing, sheltering in place, and staying at home orders. And so social distancing refers to trying to cut down as much as possible on face-to-face interaction with others, really limiting the amount of outside activities that you do. And if you do have to go out to the store, for instance, trying to stay at least 6 feet away from another person at that point. Sheltering in place and stay-at-home orders are a little bit stricter. They're often enforced by different counties, and so you should check with your local government as to what order your county may be in. And these can be enforced by the law as well, and these recommend that you only travel outside the home for essential activities. If you have questions about this, you can also contact your local government to see which of these orders you may fall under and what the different stipulations are. An additional question that we get is, what extra precautions are suggested for an immunocompromised child beyond hand washing? What if a parent is still having to work outside of the home and may be bringing germs home? We know that parents and sometimes patients still have to work at this time. We know that's extremely hard, and everyone's doing the best that they can do. In terms of additional things you can do, there aren't very many more specific guidelines. Of course, avoiding traveling and being even stricter in terms of social distancing and sanitizing. Also, one thing that is advised is to attempt to minimize the number of shopping trips made, if possible, making a longer, more comprehensive list when you go to buy groceries, or if you're going to the pharmacy, filling all of your medications at one time may also be helpful rather than making multiple trips to the store to get those things filled. In terms of coming home, one thing that we can also recommend is removing your shoes before coming home, trying to shower immediately after returning home, and putting your clothes and shoes that have been in the outside world in a separate location that can be washed separately, as perhaps another means of attempting to prevent any further exposures for the immunocompromised person. And you can find more information on the Center for Disease Control's website. They do have a category of higher risk individuals for which immunocompromised individuals fall under, and they do go over the guidelines specifically there as well. An additional question that we get is, are there any homeopathic regimens or natural supplements that I can take that would help prevent me from getting ill with COVID-19? And unfortunately, right now, we don't know of any homeopathic regimens, essential oils, vitamin supplements, minerals, anything that has proven to be effective in either the treatment or prevention of COVID-19. An additional question: I am on immune suppressing medication. Should I keep taking this medication at a time like this? And the answer to that is always follow the advice of your doctors. In general, most patients will be taking their medication during this time, as we're always concerned if you're taking such medication that by not taking it, you could cause a flare of your disease. And if you have a flare of your disease, there is the possibility that you would need to go into a clinical setting to get medical attention. And by just entering the clinical setting, you could also be further exposing yourself to COVID-19 cases. And so we advise that you contact your doctor if you have questions about continuing to take your medication. However, keep in mind that if you stop it without a doctor's orders, there's a possibility of having a flare of your underlying disease as well. But please do contact your doctor to get further information about your specific situation. An additional question that we've been receiving as well is regarding hydroxychloroquine or Plaquenil, and it reads, many have heard that hydroxychloroquine, also known as Plaquenil, can possibly help with treatment of COVID-19. Are there concerns that there will be a hydroxychloroquine or Plaquenil shortage? Should we request an additional refill of our Plaquenil? So right now, there's no proven treatment for COVID-19, but there have been anecdotes that perhaps hydroxychloroquine or Plaquenil is helpful, but the data still has yet to return regarding this medication and its use in COVID-19. We know that hydroxychloroquine is very important for our patient population and that many patients with arthritis are treated with this medication. We do say that if you're due for a refill, we recommend that you go to refill this medication now. You may also reach out to your doctor to see if they'd be comfortable with refilling a 90-day supply of the medication at this point as well. If you have trouble filling your medication, make sure that your pharmacist knows the indication for which you're filling your medication, that it is for treatment of an underlying condition, and see how much medication they do have on stock and if they can notify you when it comes back in stock. At times, pharmacies can also help you to find a complete supply elsewhere, so we would also recommend that you ask if they could assist you in that as well. And then if you still have trouble, please do reach out to your doctor to see if there's any change in your treatment plan that needs to be made, or if they can assist at all in identifying a place where the medication can be found. We do not recommend rationing the medication, skipping doses, or cutting it in half to try and make it through this time period. Please take it as directed. We also do not recommend that you share it with anyone. Other people should not be taking it unless there's a distinct indication for which they're using it. And so your prescription is for you and it is for your treatment. So you shouldn't be sharing it at this time. I do want you to know that you can look on the Arthritis Foundation website and find some more information about it. And there's also been a letter that's been penned to the government regarding the concern for a possible shortage. And the American College of Rheumatology, the Arthritis Foundation, the Lupus Foundation, as well as the American Academy of Dermatology Association have all come together to issue a joint statement about their concern for a possible shortage. So we're all trying to avoid it, and there have been pharmaceutical companies that have been trying to increase production of the medication as well. Please do keep us informed if you've encountered any troubles with refilling your medication. We're really, truly here to help. Please let us know if you have any additional questions. And if you do get symptoms such as a fever, which it's very hard to tell if it's from COVID-19 or from something else, there's no easy way to differentiate it. But if you do get a fever, cough, shortness of breath, muscle aches, or any other concerning symptom to you at this time, I encourage you to reach out to your doctor to come up with a good treatment plan and a good plan of action for workup of your symptoms. Again, thank you for tuning in today. I hope everyone out there stays healthy, and we're happy to help in any way that we can. Thank you.